I started doing research back in the late 90s. I've been in practice since 1991, and I'm an infectious disease specialist. So when I first came down here, the bulk of the people that I were taking care of was HIV patients. So I was really trying to get involved with research with some of the new therapies that were coming out. And it was very difficult to get involved unless you were at a university-based hospital. I'm a community doc. So one of the first, I met a woman who had experience doing research studies. Her husband was a doc in Shore Memorial. He was a pathologist. And she actually came to my office one day, and we sat down and talked about getting involved in research. And the very first study that I did was comparing two different antibiotics for skin infections. This was back in the, I guess around 96, 97 time. And we did a really good job at that study. We enrolled about 20, 25 patients. And then from doing good work with that study, we got involved with a study for a drug to treat intra-abdominal infections. I was actually one of the highest enrolling sites in the country for that drug. And we enrolled between multiple studies for that drug. It went from initially numbers, then to the name of the drug, and then we did studies with it for intra-abdominal infections, diabetic foot infections, skin infections. So once your name kind of gets out there in the study community, then people start coming to you asking if you're interested in doing studies. So that's kind of how I got involved in studies. And over the years, I mean, I've been involved in almost, at some point, almost with every new antibiotic that's come to market with doing research, whether it be intra-abdominal drugs or drugs to treat skin infections like MRSA. So every year, if there's something new, they'll come and, I'll get an email if you're interested in participating, that kind of thing. So, I mean, I've done over 50 pharmaceutical studies through the years. We've done vaccine studies, and how this prompted, we were involved with the Pfizer vaccine.